Hi, my name is Keith Hill and I'm a physician assistant and I work at Rutherford Regional. So the best treatment for weight loss is diet and exercise, and we have adjuncts to help us with both of those. So like for exercise, you have things like getting a personal trainer, joining a gym, or either getting somebody to walk with that helps to hold you accountable, or trying to add steps each day to help with exercise. Now on the diet side, we have what you eat. That's the diet that you choose, whether you're doing Weight Watchers, counting your calories, you're doing keto, things like that. That determines what you eat. Now, one of the things I do try to stress is high protein and low carb. It's been around forever and it just works well. The other thing is when you eat. You know, one of the things that several years ago when I went and got my certificate from the OMA for weight management, one of the things I learned is they've done thousands of studies where they've looked at when you eat and how it affects your body. And people who eat more in the morning and less at the end of the day, they just weigh less. And it makes sense if you think about it. You know, having a good protein in the morning, your body uses that as fuel, burns it up throughout the day, and then at the end of the day, having a small meal. And then the other thing with a diet is things that help us with our hunger. And that's where the medications come in. That's when the weight loss medications, the FDA approved medications that help you with that, things like phentermine and the GLP-1s. GLP is a glucose-like peptide, and so we've been using it for years for diabetics. It helps to regulate the insulin and glucose in your body. But we also use it for weight loss because when you eat food, food goes to your stomach starts to stretch, and it starts releasing those chemicals that goes to your brain and says, hey, that's enough food, slow down. But the GLP that our body makes only lasts for about 2 hours, and that's why you have a big meal on Sunday afternoon, and then 2 hours later, you're like, is there any of that cake left, or what are we having for supper? Because your GLP starts wearing off. But the GLP in these medicines, like Wegovy and Zepbound, last for 7 days. So for 7 days, it's like you have that fullness. And that's basically the way that the GLPs work in our body. I think if you've been struggling with obesity for years and you've tried diet and exercise and those things aren't working for you, then GLP could be a good option for you and something that you would talk to your provider about. Common side effects that I hear people talk to me about are either nausea. Some people get acid reflux. If you have acid reflux anyway, it sometimes will get worse. But the other thing too is I think if you eat too much food or if you eat something too greasy, a lot of times it just doesn't sit well with you, and so I think people do see more nausea from that. So some insurances cover it, but they have their own requirements. One is like, have you done exercise program in the past? Have you done diet plans? Also, they have requirements such as BMI. So if your BMI is 30 or greater, or if it's 27 or greater and you have comorbidities like hypertension or coronary artery disease, things like that, and they also look at that as well. Well, I think it's different for everyone. I think some people may require to be on it longer than others. Some people may be on it for life, but also there's other things we talked about diet and exercise. I think kind of how you're implementing those things into your lifestyle. Some people are able to come off the medication. So I think it's important to make sure that you're having a good diet as well as a good exercise program so that it helps you to maintain your muscle mass and keeps you lean, but also just being safe about what you're taking and consulting with your doctor before you do it.